try to do this as quietly as possible. My roommates are all sleeping. Let the learning begin. Patient X, a 44-year-old lady with no lymphoma undergoing active chemotherapy, was clinically admitted for a one-day history of fever. She first presented 4 months ago with bilateral lower limb swelling despite normal baseline tests. A PET-CT revealed a generalized lymphadenopathy affecting both sides of the diaphragm, affecting the neck, abdomen, and the lower limbs, but no extra lymphatic involvement. A fine needle biopsy revealed a diagnosis of stage 3 diffuse large B-cell lymphoma. She was started on R-CHOP chemotherapy regimen 3 months ago, and the tumor showed interval progression. The fever started 11 days after she completed her 5th cycle of chemotherapy, and the fever peaked at 39.3 degrees with associated chills and rigors. There was some gum bleeding, but no localizing signs of infection, and she had no previous episodes of neutropenic fever. Patient X has hypertension, is a chronic HBV carrier, and has multiple drug allergies, but otherwise she has enjoyed good past health with no major hospitalizations or surgeries. Family history was negative for malignancies, and she was a never smoker and never drinker, and she's a housewife. Her temperature was 38.7 degrees on admission, BP was 96/64, heart rate was 114 beats per minute, and oxygen saturation was 97%. Physical examination of the neck, chest, and abdomen yielded no findings, and chest x-ray showed no consolidations, and it also showed that the Hickman catheter was in situ. Patient X was ultimately managed as a neutropenic fever with a neutropenic diet and an IV meropenem. Specimens were taken from the blood, urine, sputum, and the Hickman catheter for culture. So I would say the history in this case is pretty suggestive of a neutropenic fever. It's certainly the first thing that you'd have to think about, but of course, you'd have to consider other diagnoses as well. Lymphoma itself could cause fever, especially if there have been severe B symptoms in the past. B symptoms, if you didn't know, are unexplained fever, night sweats, malaise, and weight loss of more than 10% of body weight. So lymphoma can often come with B symptoms, and if she has had severe B symptoms in the past, you'd have to think about that as well. But I mean, neutropenic fever is a diagnosis you can only make, literally after doing the CBC. So when you're in a situation when you don't know the absolute neutrophil count, then you would have to think about all the different possibilities and all the different investigations that you would have to do. Even without the presence of localizing symptoms, it could be a localized infection. It could also be traveler's fever or inflammatory conditions, but I think in this patient in particular, we're much more worried about infection. If the investigations come out normal, we would have to consider pyrexia of unknown origin. Pyrexia of unknown origin is defined as fever of over 30.0 degrees Celsius for more than 3 weeks with no diagnosis, despite investigations in either 3 days of inpatient care or 2 outpatient visits. Infections, blood malignancies can cause pyrexia of unknown origin. There could be adverse drug reactions to certain antibiotics. It could be viral illnesses, it could be connective tissue disease. There are many different possibilities, but in this patient's case, the investigations did come out to be neutropenic fever. I just told you what the diagnosis was, stage 3 diffuse large B-cell lymphoma, but actually just from listening to the PET-CT findings, you could probably deduce the stage of the cancer yourself. It's based on the N or R staging, and stage 1 is solitary lymph node involvement, stage 2 is multiple lymph node involvement but on the same side of the diaphragm, stage 3 is on both sides of the diaphragm, and stage 4 is extra lymphatic involvement. So patient X had multiple lymph node involvement on both sides of the diaphragm but no extra lymphatic involvement, so it's stage 3. You may find it harder to guess diffuse large B-cell lymphoma so specific, but actually it is the most common type of non-Hodgkin lymphoma. So the reason I talked a lot about the past medical history and the vital signs, of course, they're very important parts of the history to know, but there's also, I found this thing called the MASCC febrile neutropenia risk score, which is apparently a score that calculates whether any given patient with neutropenic fever would suffer from severe complications of neutropenic fever. So the higher the score, it's lower the risk. So I just thought it'd be fun to do it together. Burden of illness is subjective, so I'm not actually sure. I hope moderate. Blood pressure, systolic blood pressure was 96. active COPD, no. Solid tumor, no previous fungal infection, no dehydration. At the onset of fever, she wasn't living in a hospital. She was admitted after she presented, so it's outpatient, and the patient's 44 years old. So score is 24, low risk. So the Multinational Association for Supportive Care in Cancer Risk Index can be used to identify low risk, which is a score of greater than 21 points for serious complications for febrile neutropenia, including death, intensive care unit admission, confusion, cardiac complications, respiratory failure, renal failure, hypotension, bleeding, and other serious medical complications. It looks like the odds are in patient X's favor. On a final note, it talked about the patient being a chronic HPV carrier and being on the R-CHOP regimen. R-CHOP regimen being the rituximab, cyclophosphamide, hydroxydoparin, oncovin, and prednisolone. So the important part of that is that rituximab can actually cause HPV reactivation. So patients who are going on rituximab-based therapies have an indication to start also antiviral treatment for HPV with entecavir. Normally, chronic carriers would only start entecavir treatment if they have a high HPV DNA. But in patients who are going through rituximab-based therapy, even people who have low HPV DNA levels, it could be an indication to start antiviral therapy for HPV. I hope that was informative, and this is something I have been wanting to do for so long, but I just had 5 roommates come in to dorms, so I just can't find the time to actually get a space to record. I'm not sure I'm gonna do this in the future. Hopefully not always at this time. I started at 4 a.m. now it's 5 a.m. I haven't gotten any sleep. I'm so tired. You notice this, I'm in the kitchen, not in my room as usual, because my roommate's sleeping in there as well, so hopefully I can find a better location next time. I'm gonna go catch up on some sleep now. Good night. Bye.